More than 80% of newborns will have some degree of jaundice. The goal of this clinical practice guideline is to help prevent kernicterus, a permanent disabling neurologic condition. The clinical practice guideline targets four broad categories. First is prevention. This includes preventing hyperbilirubinemia associated with immune hemolytic disease and also providing feeding support. Risk assessment includes identifying risk factors for hyperbilirubinemia and also hyperbilirubinemia neurotoxicity risk factors. Monitoring includes the recommendation for at least one bilirubin measure prior to discharge home, as well as careful assessment during the birth hospitalization and beyond. For treatment, the guideline provides information about when phototherapy should be used and how it should be provided. In addition, the guideline introduces a new concept, escalation of care. Escalation of care is begun when the phototherapy level is 2 milligrams per deciliter or less below the exchange transfusion threshold and is a medical emergency. A key addition to the new clinical practice guideline is that transcutaneous bilirubin or total serum bilirubin concentration should be measured between 24 and 48 hours after birth or before discharge if that occurs earlier. The guideline provides phototherapy thresholds by gestational age for newborns without hyperbilirubinemia neurotoxicity risk factors and those with neurotoxicity risk factors. Thresholds are similarly provided for exchange transfusion. The thresholds for phototherapy and exchange transfusion were slightly increased from the 2004 guideline. The guideline provides recommendations based on the difference between the phototherapy threshold and the most recent bilirubin measurement regarding birth hospital discharge and when there should be post-discharge follow-up and additional bilirubin measures. The clinical practice guideline provides clear key action statements along with supporting evidence, specific algorithms, and tables with all the phototherapy and exchange transfusion threshold values. We are even adding additional tools to help with implementation, such as this graphical display of follow-up recommendations based on the difference between the phototherapy threshold and the current bilirubin level. Before discharge, parents should receive comprehensive education about neonatal jaundice and information about post-discharge care, including the time and place of follow-up. The guideline provides additional recommendations, including the laboratory results that should be provided to parents and to the outpatient healthcare providers. The American Academy of Pediatrics has developed material to help with the implementation of this revised clinical practice guideline, including additional educational material for families and information to help set up quality improvement collaboratives. As with any clinical practice guideline, it is important to use your clinical judgment. However, this revised guideline was developed to help improve the safe and effective delivery of care for hyperbilirubinemia and the prevention of kernicterus.